All right, welcome back to Plastic Surgery Untold. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon, and we got our celebrity crew again with us today because today we're talking about skin tightening, specifically J-Plasma Renuvion. And so we have our usual characters, one celebrity anesthesia.
What's up, everybody?
Most beautiful man, G. Berto.
Hey guys, how's it going?
And then special guest, Dr. Matt Knight-Keel from Southern California, who actually specializes in J-Plasma Renuvion body contouring. And so we've had him on the show before, and with everything going on, we ran on a short list of guests, so we got him back again. So boom, 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 we got Dr. Knight-Keel again. Thank you, sir.
Thank you for having me again, Dr. Franco. Again.
Welcome back, Dr. Knight-Keel.
Yeah, I mean,
for those of you that weren't on the last segment where we had him on, he had a little technical difficulties with. He's got a gorgeous backdrop, and I think he adjusted it 16 times. I'm not really sure what was going on, but we're gonna do a count today of how many times he adjusts it today.
I mean, I'm personally hoping for at least 4 or 5. Well, I mean, what do you think?
I had the over at 8, so.
Catch us up, Dr. Knight-Keel. What's going on with you? I know you guys are still on a little quarantine lockdown, but sounds like you're still pretty busy doing some virtual consults, some other stuff, and maybe getting a little downtime with the kids.
Yeah, we still are chugging along with virtual consults. You know, I think it's a new time for us all, right? So I'm trying to look at it sort of glass half full. We got a number of virtual consults, virtual appointments, virtual follow-ups that we're doing. I get to spend the second half of the day with my kids, which is great because normally that wouldn't be possible. So it's good. We're family time, still providing some information to patients. It's great. Best of both worlds.
And I know it's off our topic, but just kind of an update. Where are you telling people? Are you letting people schedule it all June, July, August? Or are you not letting them schedule? What are you guys doing right now in your practice?
So we are letting people schedule. Obviously, you know, we're having very upfront discussion that, hey, we're going to go back when we can go back. Right now, we're scheduled out, you know, a couple months. So I think we're scheduling into like maybe late June if there's availability in late June, but I think it's pretty much full, and we're more into July. So we had the idea that we were going to be able to start operating back in May. So May, June, we're scheduling it into July now. Hopefully that's true.
Yeah. Celebrity, what's going on with you?
About the same as last episode, man. Just trying to get some projects done around the house. Taking the dogs.
Are you a handyman? That's what I'm interested. Are you a handyman? We may have to get Mary on here to fact check this, but I just don't see you doing a lot of like Tim the Toolman Taylor type stuff. Your mustache, your mustache is legit. For those that are just listening online, check out our YouTube at Austin Plastic Surgeon because Celebrity's got a pretty phenomenal mustache. Maybe we can put it on our Plastic Surgeon Untold Instagram. Can we get a selfie of you to put on the Instagram?
Oh, for sure. I'll fire one off before we get done today.
Okay.
Yeah, I'm not like the most crafty guy, but I can put stuff together and I can do small projects around the house.
I was waiting for Mary to jump in and mute you after saying that you're a handyman. So that's right. Interesting. The fact that you didn't jump in is a plus. I
have been doing a little bit more celebrity husband duties during this time. Mary has been putting out a ton of content at Your Trendy Therapist. Shameless wife plug.
You almost missed it last time. I had to save you.
We did. I did miss the plug last time. I'm sorry. Anyway, we've been helping her with some content, filming some stuff. Other than that, just trying to hang out and keep our sanity.
In a non-creepy way, I do follow your wife on Instagram. That's not creepy at all. But
I like that you had
you got to preface it. Hey, dude, I follow your wife.
Disclaimer.
Yeah.
But so can I tell you? Can we discuss first world problems for just a minute?
Please.
My favorite is when Mary at Your Trendy Therapist is talking about how with her bad knee. For those that haven't listened, she again first world problem. She had a skiing accident and has had a knee surgery. But she was talking about how rough life has been because she hasn't been able to go upstairs to her dedicated blogging room that she has. That one celebrity anesthesia television made for her that has several mirrors, some speakers, soundproof rooms, and then different decors on each wall so that to optimize her blogging. So
by different decors, I think you meant thousands of dollars in designer bags. Yeah, she has mentioned that a few times, that has been the biggest issue with the knee injury.
I'm just gonna say that's first world problems when you can't get to your dedicated blogging room in your own mansion. But for the rest of us peasants, we'll just continue on.
When you're saying soundproof, is it got like that foam, that soundproof foam?
No foam, but
it's built into the walls because the wall hangers for all the designer bags don't really go well on the foam.
That's exactly right.
I need to, in a non-creepy way, also follow your wife.
Oh, give her a follow at Your Trendy Therapist.
I get it. The trendy because of the purses. So
yeah,
I like it.
She's an occupational therapist, so she's the trendiest of all the therapists.
Okay, that's a good brand.
You see, I always misread that title because I thought that it was like shopping therapy was their stuff.
I definitely thought you were gonna. I thought you were going to say that you read it as Your Trendy, the Rapist. And I was like, wait a second.
Wait, what?
Damn,
that's a totally different.
You are on fire today, dude.
Which is a shout out to Arrested Development, right?
On that note, let's go to most beautiful man, G. Berto, because we don't want to get not available for public use here on this podcast. What's going on with you, G? Last time we connected, you were cleaning, you were sorting, all sorts of really exciting things. I mean,
yeah, I got in trouble.
Like, damn, G. Berto must be beautiful.
I got in trouble. I had to dial up the fun factor.
So what did you do over this week to dial up your fun factor?
So we figured out a way to make watching movies more interesting by playing drinking games as we watch them. So
now this is fun. What was the drinking game?
Continue.
So there's like different websites out on the internet. All you got to do is basically Google the movie
you're watching.
There are different
websites out on the internet
that have different drinking game rules. So you basically just Google the title of the movie that you're watching or TV show, and then type in drinking game, and you'll get a ton of different websites, as Dr. Franco alluded. There's all these different rules, and so we've been watching a bunch of movies and just getting blitzed. So
okay, sounds good.
What was the favorite movie and what was the drinking game?
So every movie has different, like you drink once if a certain character comes on screen. You drink twice if a certain event takes place. But we actually made our own rules we're big Westworld fans. So we made rules to last night's episode, and man, we got lit.
I've never seen Westworld. Should I put that on my list? Because you guys gave me a couple nuggets last time.
As a guy that likes Star Wars, I don't see how you haven't been watching Westworld.
Yeah.
I've been busy taking over the world.
He's a hardworking man. He's a hard
and starting this podcast. You think herding these guys together is like herding cats, dude. So it's a full-time job. But let's jump into a little bit of fun here.
You're the Tiger King, John.
Before
he plays here, kitty.
Before Gilberto gets us completely off tangent. So one of the biggest questions we get in plastic surgery is always about skin tightening and body contouring. And so I think, there's obviously been the different extremes. So, there's Botox, there's fillers for kind of very minimally invasive stuff in the office. And then obviously there's our big tummy tucks and body lifts and thigh lifts and those type of things that we do as well. That's the other extreme. But there's the people in the middle. And for our 18, 20-year-olds, with great skin and so forth, they do phenomenally well with liposuction, but there's kind of that gray area in the middle with people that have a little bit of loose skin and maybe they're not ready for a tummy tuck. Maybe they're not ready for the downtime. Maybe they just don't want the incisions, but for whatever reasons, just aren't ready for one of those body contouring, skin excision procedures. And so let's talk about something called Renuvion J Plasma and how that fits. And, we'll get Dr. Nykill's thoughts, because one of the issues with skin tightening and some of these devices out there for the past 15, 20 years is I think people have felt like they've spent money and maybe not gotten something back. And so it'll be great to hear your guys' experience and about this. Celebrity sees some of these procedures with me in the surgery center. I know G. Berta has some experience with some of the other machines that are able to do some skin tightening in the office, and hopefully he'll give us his input on that. And Dr. Nykill has a ton of experience with J Plasma Renuvion and is actually a trainer for the device. And so do you mind just kind of telling us a little bit about what it is to start with, and then can we jump into whether it actually works or not?
Right. Yeah. So I agree with you completely. The problem with liposuction has been that, in my opinion, once you cross about like 26, 27, once like second puberty starts going on, for those of you who ever watched College Humor, right? The skin just doesn't have that same elasticity. And liposuction itself will tighten the skin a little bit. I say like it's like 10%. It gets you a little bit, right? But lipo treats fat. It doesn't really treat the skin as much as we would like. And that's really kind of where we've been stuck. There's been a couple devices that have kind of come along, one of which is, for completeness sake, is something called Body Tight, which is another sort of radio frequency emitter. Then J Plasma came around, which used a dual modality. So it tightens your skin. Just like liposuction, we put a cannula underneath the skin. The J Plasma, same thing. After we do the lipo, we expose all that collagen, and then we can put another cannula underneath the skin. We step on a pedal, and it fires heated helium gas under the skin, heats it up to about 43 degrees, I think, Celsius, 40-ish, in about 0.004 seconds. So fast that the outside temperature of the skin doesn't change. And that's actually been really revolutionary, because the major risks of using energy, which is heat, to tighten your skin is, heat tightens anything, right? Like we all have experience with that. But there's a point in time where we heat it too much and it burns. And so the really cool thing about this device is it's not causing burning as much, because we're not heating that exterior skin.
And isn't that where the original name J Plasma came from? Is this helium with the energy converts into an inert plasma, and that's where kind of the uniqueness of the rapid cooling off, and I think that's some of the differences, and you can correct me if I'm wrong, between it and something like a Body Tight, which takes a little bit longer because it doesn't have the instant cooling. Is that correct?
Yeah, I agree with this. I think so. Skin tightening devices like Body Tight have actually been around for a while. So J Plasma is bringing new technology from a plasma standpoint as far as heating and cooling rapidly. It also employs the same radio frequency technology. So from that standpoint, the radio frequency technology isn't new. It's the plasma portion, and we're not seeing a huge shift in thermal temperatures. And what that means is a decreased risk of burning. And you're right, Body Tight used to take forever. So that's the other reason why it never caught on. It would take you an hour plus to try to treat, let's say, your torso. And just when you figure OR time, anesthesia time, tech time, et cetera, it just priced itself out to where only a few people could really afford that type of technology.
And then you've brought up about 16 good points here, and I want to circle back to some of these. I think one of them was, age for a liposuction, and you had said something that people over the age of 26, sometimes are difficult candidates. But I want to elaborate on that a little bit, because I've seen 20-year-olds that are not good liposuction candidates. And the flip side, I've had some 40, 50-year-olds who, with some targeted fat transfer do just fine. And so I think that age is a factor, but it's not the only factor. And I don't think there's a specific age that makes you an absolute good fat or lipo candidate, and an absolute age that rules you out per se.
I agree with you. I think everyone, you're always trying to categorize just both to help make decisions and also to help sort of inform people. So when I threw out that number, sort of the late 20s, to me, most people, when we get to our late 20s, our skin just isn't as tight as it once was. I think that's just part of the aging process that sucks. It's one of the first things we notice. So when you're that age or older and you come in wanting lipo, that's when we really need to look and say, okay, we need to talk about, yes, we can treat the liposuction, but how do we treat your skin piece too? There's always exceptions. I totally agree.
And then that's the plus minus of doing, and why you come see a board certified plastic surgeon, right? Is, deciding what do you need, because sometimes there's trade-offs. Hey, look, your skin's not going to be, baby butt smooth tight, but maybe you don't have enough skin that it's worth doing a tummy tuck, or maybe that's just not something you want. And you and I have the conversation all the time with people like, look, you're still going to have a little skin laxity, but they're like, okay, I get that. I just don't want this full tummy tuck thing. I'll come back in 7 years and get it done then, and so forth. So I think that's a big plus. And then the next one I want to go back to what you brought up is time. And people, a lot of people probably say, so what if it takes more time? And I'd like to bring celebrity anesthesia in here, but he knows that with some of these bigger body contouring, like when we do a BBL, it takes me about 4 hours. But, if you're adding another significant amount of time to this, overall risks of the surgery go up. Celebrity?
Yeah, I totally agree with everything that you're saying. I think that the biggest deal is increased time under general anesthesia just puts the patient at more risk for everything. The longer that patient is not moving, the longer that patient is mechanically ventilated, the longer the patient is cooling down, just because you are going to have that thermal loss in the OR, which again, if you're using something like Body Tite or whatever, it takes even longer to heat up and get to temperature and to be able to use. So I think the J Plasma has been a huge advantage at our place, just because it is quicker. You only have to make, 7 or 8 passes in each of the areas. It does happen very quickly, and the changes you can see almost instantaneously.
And I think it's important to distinguish. It's not that we're in a hurry. It's that we're trying to be efficient, and we're trying to be efficient for patient safety. And obviously, if you're just doing neck lipo and then doing tightening of a neck, I don't think that's a huge difference. But Dr. Nikio and I do a lot of BBLs, Brazilian butt lifts, where we'll lipo the abdomen, back, flanks, maybe the arms, then do some fat transfer to the butt and hip dips, and so the more stuff you're adding, and if you're doing J Plasma to all those areas, it's not an insignificant amount of time, even if it's only 20, 30 minutes. So I think it's trying to be safe and efficient. Nikio?
I totally agree.
Yeah, I agree with you. I think it's the quicker something can get done effectively and still give a good result, obviously, the safer it is from a operative standpoint. And also, I think from a patient standpoint too, I mean, to some degree, everything is about how much just the price of something, right? I mean, I think that's the reality. So the quicker we can get something done effectively and providing a good result, the less it's going to cost, because they're just everyone's time starts to have charges to it.
And as you know, celebrity anesthesia is not cheap.
I was just going to say that. I mean, this guy's not giving us a discount on minute 1 or minute 200. You know what I mean? He's still just ticking away.
It costs me an @Trendy Therapist plug every episode. I mean, absolutely, without fail.
So is this something that is done strictly in the OR during a procedure? Is it something that can be done in the office, or?
It's a great question. So we do both. We do in the office and we do in the operating room. It's such a beautiful procedure to pair with liposuction, because your steps of liposuction already expose the collagen. So a lot of research is still getting done on this, but what we're finding is the better job that we do on the front end of exposing the collagen for that J Plasma to kind of, after we put it underneath the skin, to be able to act on the collagen to tighten it up, the better the results will be. And it's kind of intuitive, but that's what we're seeing. So we can do it in the OR or outside the OR, completely reasonable. I still think the basic steps of sucking out the fat, exposing the collagen are still very, very important in order to get that nice result. When that can be done in the office or in the operating room.
And just kind of depends like what you're doing. To Dr. Nikio's point, a lot of mine are done at the same time of of lipo. And not to say that you couldn't come back and do it later if somebody wanted it, but it's from an efficient standpoint and most patients' downtime, if they're going to have those areas kind of treated, they kind of want to treat it all in one. And it always takes some recovery. And so you can drag out the time a little bit, because if you do lipo and then have to wait to do it again. But I think especially if you're looking at like doing like an isolated neck or something like that, I think that's super reasonable to do it in the office. We've even done a lot more treatments in the office with Pronox and the nitrous gas stuff, which is made doing some of the office procedures that are very sometimes are maybe a little bit more painful, like an Althera or some of these that I think Gilberto is going to get to here in terms of other skin tightening, radio frequency energy devices stuff. But that's made a big difference for us. Do Celebrity or Nyquil or Gilberto, do any of you guys use any of the office-based nitrous devices? I know Pronox is one brand, and I know there's another one out there, but I'm blanking on the name.
We have used nitrous. I think it's great. I mean, it's in our fields as physicians, it was an underutilized drug, right? And I don't know why that is, because the dentists and the people in the dental profession have been using it, I mean, since they've been forever, and once you start to use it, you really realize, my gosh, this makes just everything that you do so much easier.
And when we're talking about Pronox specifically, it's a self-administered. And the idea is that if you ever got too much, you just drop the handpiece and you stop giving it to yourself. So you're not forcing on anybody. And part of that is what makes it so safe. And the nice part of why it's become popular is it's quick onset, quick offset. So that's really kind of key.
Dude, you're taking all my education pearls away. What am I, just hanging out over here drinking Topo Chico? Shameless Topo plug. We are available for sponsorship.
G, catch us up, because I know in the derm world, I know Nyquil and I are talking like this stuff is revolutionary, but you guys in the derm world have been doing a lot of skin tightening stuff for years, and unfortunately, I think have given skin tightening a little bit of a bad name in the past.
Yeah, I mean, skin tightening has been around for a long, long time. There's a lot of different devices, a lot of technology that's kind of progressed over the years to help with, trying to achieve that ultimate goal of, having nice, tight skin for trouble spots. In our practice, we employ the use of Ultherapy, which is by Althera. And that's a little different than J-plasma in that it uses ultrasound as its energy source versus radio frequency. And the claim is, if you go to their website anyway, their claim is that with this Ultherapy treatment, you can get micro-focused ultrasound energy into different depths of the skin, which for something like a J-plasma, where you're actually in the skin, with a cannula, I think it's very different. But if you compare Ultherapy to other radio frequency type treatments that are available, they claim that it's far superior. And I think it's because, go ahead.
But just so people don't get confused, where J-plasma, Renuvion, and Body Tight actually go under the skin, Ultherapy is done externally, and so the probe never actually goes under the skin. Correct.
Correct. It's non-invasive. Essentially, it's basically a handpiece that goes over the treatment area externally, and the energy is being sent to these different layers of skin through the apparatus itself.
And I think this has been one of the big changes with Body Tight and J-plasma Renuvion versus like Althera, or if you even want to go even further back in the day, the Thermage. And I'm not saying that there's not a place for those devices, but is the amount of energy that can be released when it's underneath the skin, I think is much higher. And I'd love Nyquil to talk to that as a trainer for J-plasma. When with stuff with like Althera and Thermage that were above, the limiting factor has always been that external and superficial skin, because we can't get burns or damage to that as your point was earlier. And that's one of the benefits of J-plasma really cooling off really quick, is avoiding the skin burns.
Yeah. So we know, and obviously I'd be curious to hear from, is it Mr. Beautiful? What's his nickname that we're calling him? I like Mr. Beautiful though.
Yeah. I like it too.
Mr. Beautiful's pretty good. I like that too.
And I'd love to hear Mr. Beautiful sort of derm reference on this, but we know that we got to heat that skin up above like 83, 84, 85, 86 degrees Celsius, right? Like to get skin tightening. So I think I said 40 degrees Celsius earlier. I meant to say 86.6. That's what it heats it up to. Long and short for our listeners to kind of bring this back down to, I think, a level that kind of like when you're saying, okay, what are you guys talking about? If you were younger and you played with shrinky dinks, or if you've ever played with plastic and if you heat it, it shrinks up, right? But there's that limit to where too much heat, it lights on fire. And it's a really quick change between plastic shrinking, plastics burning, right? So the same thing's true for your skin. All energy means is at some point in time, it's going to turn to heat. So we know that we can deliver different energy modalities that are going to off-produce heat, and eventually that energy is going to cause your collagen and skin to retract. But at some point in time, there's a real quick changeover from skin contraction to skin burns. And in the past, that's been an issue with any technologies, right? So one of the cool things that happened with J Plasma, or Renuvion, as it's also known, is you're right that it's a very rapid 0.004 seconds, 44 seconds of super heating, super cooling, and that decreases risks of burns. So we're able to deliver effectively energy both from plasma heat energy and also from a radio frequency energy standpoint that takes you up to that limit and then pulls it down really quick, so we're not leaving thermal burns, thermal injuries to your skin.
Gilbert, and any thoughts between that and Ulthera and stuff? And because I want to kind of roll into who's a good candidate for each one. Like, how would you decide? Am I a better Ulthera candidate for my neck? Am I better J Plasma or Renuvion? Am I a better neck lift candidate? Because I think that's the whole spectrum here. Or do I not even need Ulthera? Can I just do like a little jawline augmentation and filler and maybe a little Botox on my neck bands and not even do Ulthera? Like where do people fall in that spectrum? Anybody want to tackle that? I know that's kind of the $1 million question there.
I mean, in my practice, I get a question of, and I'm sure you get this a lot too, Johnny, do I need a tummy tuck? Or can I get away, or am I able to do less invasive things, right? And so I think a little bit of all is always goals. I always try to say, hey, the tummy tuck, which is that where we cut the skin out and we pull it down super tight, that's always going to be the gold standard because we're physically going in, removing skin and tighten it down as much as we can. Renuvion J Plasma has shown to tighten the skin up by 60% over 6 months. I kind of say you'll initially see like a 20%, 25% tightening right on the table, and then it'll slowly tighten up over 3 to 6 months. The question is, does that 60%, will that achieve your goals? And I think that's a little bit of where the consult, where that board certified plastic surgeon or board certified, dermatologist, doctor, whomever's talking to you about, hey, should I go with a less invasive or more invasive treatment? That's where that discussion takes place. What, Mr. Beautiful, what is Ulthera's tightening that they say? Like how much tightening can you expect percentage wise? Do they give you that info?
I don't have that information in front of me, so I don't know that I can give like percentages, but yeah. I know that it is something that does kind of continue to improve over time, kind of like with J Plasma or with like a Thermage or something like that. You don't see necessarily, the final effect of the treatment, instantly. It's something that, can take up to 6 months before you actually see the true final result, so to speak.
And some of that goes into the spectrum, right? Because with Ulthera and Thermage, this is just done over the skin. There's no incisions. There's no probes under the skin, and then as you go kind of down that spectrum, you got the lipo and J Plasma Renuvion combination, and then you keep moving down the line and you have tummy tucks. I typically tell people if you got true skin just hanging down, over your C-section scar, over your belt line, it's probably going to be a little difficult to do, a skin tightening device and get you to a point where you're super happy. And that's where we have to have a little bit of real talk, in terms of like, hey, this is what we're going to get and this is what we can't, because they may still say, look, whatever percentage you can make me better, I'll take. I just don't want to have a tummy tuck. And I tell people, I was like, look, I'm okay doing that as long as we're both crystal clear that this is where I'm going to get you. You're still going to have some loose skin. And I have them verbalize that back to me to make sure we're on the same page. And so I think that's a great point. Nike is trying to figure out what are their real goals here, because it's not our job to tell everybody that you got to fit into one cookie cutter model, and that's not fair. And so, our job is to help kind of understand where you're trying to get to and then help guide you there. So, that's kind of how I approach it.
I think that this lends itself perfectly to the last time that we talked and had a little podcast, and we were talking about some of the things that are going to come from COVID and this downtime and seeing patients virtually. I think this is a great.
Say that people are going to have more time to listen to our podcast, and that's in the world. So
they're already doing that. No, but I think this is a great place in my mind for telehealth, right? If you can have that conversation with somebody in 15 minutes and you can do that education on, hey, this is what you can expect from this versus this, here are your options moving forward. Then when they come see you in the office, they're better prepared as a patient. They have some of the answers and the research already done for the questions that they had. And then you can actually compare apples to apples in an in-person, pre-procedure screening.
No question, because the recovery time between a tummy tuck and just a lipo J plasma is a pretty decent swing. And so, totally. I think when they can or can't do that in their life is huge. I also think, can we touch based on what areas you can do some of this body tightening J plasma? Because I think that's super important too. I actually really like it for obviously I most commonly do it with my BBL. So kind of the trunk 360 and it works well and fine, but arms, I felt like there was a big no man's land for arms where people were, I was like, hey, I just really don't think, if you were my wife, my girlfriend, I would tell you, it's not worth it to do a brachioplasty and get that scar down your arm. And, but they're like, I know, I don't really want the scar either, but this bothers me. And I just knew if I just did lipo, they were going to be disappointed with loose skin. And that's really been a huge gap filler for me. Same thing with necks. It's just people who've like, I didn't want a lipo because they already had some borderline loose skin, and I was worried about it. So, Matt, any thoughts about that? How that's changed your practice, and whether you've seen that difference too?
Yeah, I would agree with you 100% that it has. I would use the term revolutionize my arm practice, right? Because I think it has allowed me to get arm liposuction results that people are happy with. Because most of the point in time when people, at least for me, when people would come and say, I'm unhappy with my arms, they would immediately do this. And they wouldn't, their first move was not that they were grabbing their fat. It was that they would swing their arm like this and they would watch their arm jiggle, right? And in your head is, as the surgeon, I'm sure you thought this too, Johnny, you're like, yeah, I mean, we can suck that fat out, but there's a good chance then that arm's going to still jiggle and potentially jiggle more, right? And so, but then on the flip side, you're thinking, hey, before we had J plasma, if it was just jiggling a little bit, is it really worth having a scar that goes across your arm to get rid of that? And most of the time I felt, no, I wouldn't want that. So J plasma to the arms that's something that's completely changed for me. I'd be the first one.
Yeah, no, celebrity anesthesia, and I used to talk about this all the time, that we turned away more patients for arm surgery than we actually operated on, because, I'd be like, you weren't a good candidate for this, and then, I don't want to make things worse. And so, for sure.
Yeah. The next thing I'd say that's really, I've seen a huge benefit on is, again, we talked about, for the most part, late 20s, certainly by like 30, if I'm doing waist lipo on you, I'm really talking to you about J plasma, because your waist is obviously, sometimes over time we store up some fat in our waist, and it's not as sharp, it's not as just sort of feminine, it's not that hourglass, but that's twofold, right? It's fat, and then it's also skin. And so if I can get that skin just tighter, 60% tighter, I'm going to make that waist just a little sharper and broad in it. And I felt that my waist results just look cleaner, smoother, and better because I'm getting that skin to tighten up a little bit more, right?
And I just want to be clear to people that neither of us are suggesting that J plasma, Renuvion, Body Tight, Ulthera, any of these are a replacement for tummy tuck, body lifts, brachioplasty, face and neck lifts. For me, it's really been an adjunct to liposuction. It's been a gap filler for some of these treatments, but I don't want you to get the idea from this podcast that we are replacing tummy tucks, and you're never going to see us do a tummy tuck or brachioplasty again. Because in my, and you can correct me if you disagree, Dr. Nykiel, but I don't think that that's true.
No, I think that the people that you looked at and you said you need a tummy tuck, they still need a tummy tuck, right? I think kind of what we were talking about, there was this whole gray area where we'd say, I don't have a great option for you. Or there was the whole area of people who said, like, I hear you that I need a tummy tuck. I'm not doing it though. Do I have any other options? And previously I'd be like, I don't have an option for you. Now we do, which is pretty cool, right? Bra rolls, by the way, I just want to jump back. Bra rolls are the last place that I really push J Plasma or Renuvion skin tightening, because I think even with great liposuction, even when we're utilizing Vaser lipo, et cetera, I'm able to blast out a lot of that fat. But especially for all that sort of, area around the bra, if I can just get that to tighten up, I just think it gets such a nice, cleaner result. I don't know if you're using a lot for bra rolls too.
We do, because it's an area that we commonly lipo, and kind of to your point, we get a lot of patients who come in, look, if I'm going to do this, I want to be as tight as possible. And I could be downplaying and tell them, they'll get 15-20% tighter, because, the old saying, under promise, over deliver. And so I'll tell them 15-20%. And people are like, if I'm going to do it, I'll take 15-20% tighter. And so definitely, we do the bra rolls for sure. And I think it does help in those areas for sure. Celebrity, any issue on your side when we've done anesthesia for these cases? But I feel like people have tolerated it pretty well, because we've already done a lot of the pre-tunneling with the tumescent and so forth like that.
Yeah, I mean, anesthesia-wise, it's the same thing as massive liposuction or large area liposuction as far as how I treat it. I mean, if you and I were going to do someone and just do body tight or just do J Plasma or Renuvion, we could get away with doing some sedation or something like that. But there are obviously other alternatives. But for the most part, you use it as an adjunct to large volume liposuction. So we just tack it on, and I do it just like a regular general anesthetic.
And I don't want people to get the wrong idea that we're also, saying that Body Tight or Althera, these procedures are not good, because I think they have their place. And I think that Body Tight has some great, I think they have more hand pieces and some other things in terms to incorporate it with RF microneedling and some other small facial stuff. I know J Plasma Renuvion is working on some more hand pieces to open up the areas that we can do that. And Nykiel probably knows more about that than I do. But they're both good devices, and something to talk with your plastic surgeon or dermatologist about in different areas. I think when you're doing small areas, there's definitely some cool things that the Body Tight does that's super helpful for that. Althera is another great one that's done by the estheticians, that can be done in the office or nurse really quickly without any incisions on the skin. So there's definitely some big pluses there too.
Yep, they are working on a number of hand pieces, and I agree with you. I think Body Tight's a great device for smaller areas. I mean, I think it's great. I think that what pigeonholed it was it didn't do well on large volumes or large surface areas. The other thing, if we had a moment, Johnny, I just kind of want to talk about, because I don't know about you, but my patients get confused a little bit about when we put Renuvion or J Plasma as an adjunct to liposuction. We're usually putting it on at a significantly sort of decreased price than we would if you just came in to do it. And I think sometimes people get confused a little bit on that. So I was hoping maybe we could just spend a moment just sort of talk about why that is.
Please. I think that's a great one.
So we kind of talked about this a couple times. In my opinion, and I think when you look at results, Renuvion / J Plasma, these skin tightening devices work best when you expose the collagen as much as you can for the device to act on the collagen, right? So I think that's very intuitive when you hear it, but I just want you to sort of think about that. And so the way that we as surgeons expose collagen is we put cannulas underneath the skin, and we basically break the fat up. And by breaking that fat up, it helps to free that collagen up so it's exposed, and then we can come in with our J Plasma cannula and tighten everything up. The only difference between me doing liposuction and breaking fat up is me stepping on a pedal that sucks the fat out as I break it up. So all the steps of liposuction really need to be done in order to perform that Renuvion or J plasma. So when we say, hey, we're doing lipo and we can add this Renuvion J plasma on, it's typically done as a great add-on because 75% of the work, wouldn't you say, Johnny? 80%, 75, 80% of the work is already done before we even put the cannula in. Whereas if you came in afterwards, you'd be looking at prices very similar to a liposuction. I mean, wouldn't you think?
100%, you know, and you're adding almost double the time because you got to redo all those
Yes.
phases. Also, too, if people have lipo and then they decide later they want to do some skin tightening, we actually make them wait. Because now you got to let all that scar tissue settle and let the skin kind of free up before we can do that again. So I think that's a phenomenal point to make sure you think about it before you decide one way or the other, because there's going to be a lot more costs later. And then there's also just the time of waiting.
Yeah. And the reason I think it's important to talk about is, you know, if any of you have ever remodeled a home or anything like that, you know, you can get your contractor in for one project. And then all of a sudden they're like, well, we could extend it and do this. And then we can do this. And then we can do that. And there's that point in time where you're like, whoa, these costs are ballooning out crazy. Like, let's focus on the project that I looked at. But this really is one of these things where you're basically doing everything that's required. I would really give strong consideration to really thinking about adding on skin tightening devices if you're undergoing liposuction and your surgeon feels that it's appropriate, because it's significantly more work to go back and do it later. And I just think that that's a really important thing to stress when we talk about these treatments.
I think it's super. I love the analogy with the contractor. I would think it's very similar to having guys come in to paint the inside of your house and you tacking on, you know, doing the trim work or something. Whereas they've already gone in, they've built the scaffolding, they've set up the ladders, they've done everything that they needed to do the original paint job. They're just touching up and doing the last little piece of it. Instead, if you just had them do the trim, they'd have to build the scaffolding, do all the stuff, tarp everything just to do the scaffolding.
Yeah. I thought celebrity husband was going to give us the analogy of buying like a new purse and then having like a little money bag to go with it on the inside. So something that I thought was
trying to piggyback off.
I thought that was something that was going to hit home a little closer to you. Other than I didn't really know you'd have a lot of familiarity with the GCs and general contract work.
It's the mustache.
Okay. We're running short on time here, but I want to ask you one more question on a question I have, Nykiel, about J plasma Renuvion. How about for the non, and I don't want to say non-surgical, but non-fat transfer, non-butt implant skin tightening for buttock? Because I mean, you know, not everybody wants a bigger butt, but there's a lot of people out there that just don't like the loose skin. And you and I talked about it on IG Live yesterday. You know, the circumferential body lifts and some of these, they actually tend to flatten the butt a little bit and don't. I haven't been super happy with the way they do this. And obviously that's a much bigger procedure than if you can do Renuvion, J plasma, or body tight treatment for a buttock. Any experience, thoughts you have with that? We've done a few people in the end. Now with COVID, it's been hard to get people back in for follow-up visits to really kind of see how that's gone. So I'd love to hear your thoughts on that.
Yeah, so I would say yes. So we have been increasingly more aggressive in using it for these sort of Renuvion butt lifts, and I've been happy with it because it gives back skin tightness. It does not flatten the butt, and so I think that's been very positive. The other place we've been using it sort of that thong area, you know, where you kind of do those little thong lifts. I've been very happy with it there, and I have begun to use it a little bit in the banana roll area. And so the banana roll area has always been a very hard thing for us as surgeons, because if we liposuck the banana roll, we know that we make the butt actually look more saggy. There's very famous celebrities that probably come to mind when you start thinking of a banana roll being sucked out and being very saggy. So I've actually started to J plasma Renuvion it with some early on promising results. So I've been very happy about that also.
Maybe we'll have to have you back on in about 6 months and kind of get a follow-up, because I think that's maybe we'll do everything but or something. That would be a great episode. Can I tell you another area where I've been super, super happy, where again, they've been in a category like the arms where I just didn't know what else to do for them. And I'm sure you have some in your practice, these people that have done a phenomenal job with the massive weight loss, and whether they have
I was actually trying to talk about that. Yes, I agree with you.
whether they had bariatric procedure or just lifestyle changes and lost a significant amount, we'll do tummy tucks on them and they'll look great. And when they're standing up, that skin's tight, but they bend over and they still have that real kind of skin laxity that just drives them crazy. And when we've gone back on some of these patients who've had the tummy tuck, there's no more skin to excise, but they just don't love that texture, that tone of the skin. The J Plasma has made a phenomenal difference. And I would say that's been some of my happiest patients because the difference has been so dramatic for them, especially on their tummy.
Yep. So I would agree with you. And I would say also another group is, that tummy tuck is pulled tight this way, but, sometimes that same patient would grab their skin and push it sort of in towards their belly button. And they would feel it's just loose, right? And up until these devices, we didn't have an answer. We'd say your answer was you could put a midline incision on their tummy, but that looked
fleur-de-lis, if you will.
Yeah, right. Yeah, so they looked like they had an like a laparotomy or emergent tummy surgery. That just wasn't in the cards for me. I just never thought that looked good. And it's been great there. It's just been, and also stretch marks, right? So I thought for myself, I've been seeing significant improvement in stretch marks. You can never get them to go away, but they're getting smaller and less noticeable. So it's really been cool.
We have some people, and obviously they've been put on hold now, but who've had brachioplasties in the past because there's a limit to how tight you can make a brachioplasty, without making a tourniquet in the arm. And there's a couple of people who we have waiting to do this for their arms, again, for the same thing of trying to tighten that. And I feel like we could go on endlessly with the body tightening stuff, but I want to start wrapping stuff up a little bit here. Any take-home messages from our celebrity crew before we jump into a few other topics?
I mean, I was just going to say, as a layman with this, I can actually see a difference on the table. And I've seen J Plasma done in the OR. We've also used Body Tight several times in the OR as well. And these are actual, like, you can see a result on the table. So for the uneducated onlooker on the device, it's pretty impressive.
Agree.
I think I was just gonna say, I think it's important to just kind of make sure that you are in tune with what your patient's goals are. Like we talked about earlier, and this is kind of like the fine tuning of a lot of these procedures. It's the icing on the cake, the cherry on top of the sundae, whatever you want to call it. Doing these procedures in conjunction with your liposuction surgeries, you're going to just have a more phenomenal result when you do them in conjunction with one another.
Can Dr. Nykiel, any other last take homes?
No, I think we've hit it pretty well. I just think when we talk about the Renuvion J Plasma, the reason we're all very excited about it is it's allowing us to do it in a much quicker and efficient way that's really allowing it to be used on more areas and for more people. And I think that's why we spent so much time talking about it, because it's just been so beneficial. And I'm a trainer. I just want to plug myself. I'm the guy that trains people.
At SoCal Plastic Surgeon. I know I've been skipping a little factor fiction later because I'm trying to keep people with some things to do during their quarantine time. And so can we go around the room again and people maybe give one idea of something to do during this quarantine time? And I'll even go first this time. Me and the family actually for Easter did a little Zoom lunch. So, my brother has a baby little girl, and so he was by himself. Mama Franco was out by herself in New Mexico, and so we scheduled a time, did a little Zoom lunch, and boom, 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 Easter lunch together done on Zoom. So it was a unique experience. There were some technical difficulties, but my brother helped my mom walk through that. So that was one thing we've done in quarantine just to kind of spice up the days a little bit. But I'd love to hear some other suggestions for people to share with all of our listeners.
That's awesome. I think it's super cool to be able to connect with people virtually like this in this time where everybody is having to stay at home. One of the gyms that I go to in Austin, they're called Heat Boot Camp. You can look them up on YouTube. They're actually posting a free high intensity interval workout every single day. So it's just like going to the class. It's totally free. And it's maybe between 30 minutes or an hour long. So yeah, give them a YouTube. It's pretty cool. It's free workout.
And that's called Heat?
Heat Boot Camp, HEAT.
Boom. Gilberto, most beautiful man. Any hair product suggestions?
I thought we were going to Mr. Beautiful.
No, but I have been working on my cooking skills a little bit. Since it's kind of quarantine life now, I've been trying to cook a little more and experiment with some different recipes and stuff in the house.
Please
love
do
cooking.
share. What has Mr. Beautiful cooked for us?
So recently it's been a lot of breakfasts, but I also made a really good spaghetti sauce the other day, and we cooked up some noodles and had a little Italian night.
People get crazy about their spaghetti sauce. So walk us through kind of what are you doing for that pasta sauce?
So I use ground bison because it's a little bit leaner. It's a little drier too, so you have to kind of take that into account. But if you have other ingredients that you can throw in to give a little bit of flavor, some like fat content. And then I did more of like a garden variety kind of sauce or gravy, as some of y'all might call it, with some diced up carrots and celery and onion. And then I used this really great pre-made sauce by a brand called Rao, R-A-O. They're like really clean, minimal ingredients. It's basically just tomatoes and salt and I think like celery salt or something like that. So
Heat Boot Camp may need to get you involved, because I think this sounds like a phenomenal partnership. Like, eat healthy with some ground bison, a little bit leaner, and your workout. So I
like it.
Bertos, there may be a love match going on here.
I like it.
He described making a roux. That's what he said. I'm gonna make a roux. A French roux as a base, and then I'm gonna add some other stuff to it. I mean, that's dense.
Gilberto's serious with the cooking these days. I love it.
Just experimenting
not
a little
just
bit.
good looks, I think.
No. For those of you that are listening, this is a wonderful man. Nike, what about you? And any little nuggets to drop with people?
Yeah, I'm doing two things. The first thing is myself and my college buddies actually twice a week we do a group FaceTime together. We call it the Male Crisis Convention Club, just because of everything going on in the world, so we all get on there. And actually, right now we can only drink gin or vodka tonics because that's got quinine in it, and so there's the hydroxychloroquine or chloroquine. So we feel like we're being healthy at that same time. You know what I mean? And then outside of that, man, I'm barreling through movies still. That's what I'm doing. Just passing the time with some good movies.
I like it.
Incorporate some of these drinking games we talked about earlier.
Yeah, yeah, that's right.
Can we get a quote of the day to wrap this up? Do we get a quote of the day?
I got one.
No, that's all you.
Okay,
I got
G.
And I think it kind of ties into what we were talking about a little bit. So Roger Staubach, famous quarterback, Dallas Cowboys.
I'm familiar.
Yeah. Once said, "There are no traffic jams along the extra mile."
Damn, dude. You've been bringing the hammer. I say that you've honestly been trumping Travis like a king.
Dude, I hit you with some Nelson Mandela, and he gives us a football quote. Come on.
But that one hits home. Right now, Nike and I are going the extra mile. We're trying to be available for our patients. We're trying to, spread some good information. We did a little IG live on a Sunday, and you know what? It's been a lonely road on this extra mile. I know what you're saying. Thank you, Gilberto, for bringing this home into my world. And on that note,
that thing really fired old John up there.
I'm ready.
I saw it in his eyes, man. It was
my goodness.
I want to thank Dr. Nightkill for joining us, and you guys can follow him on Instagram at SoCal Plastic Surgeon. I'm reading this right off of his beautiful backdrop that he has behind him. So I appreciate we didn't have any functional deficits or anything on this podcast like we had before.
You were nice enough to invite me back for round 2, and I said I got to get it together for round 2.
And then, of course, Celebrity Anesthesia and Gilberto Signs. And for those of you that listen religiously, we've cut producer Donald off of this. We just couldn't have him on the Zoom. He's been hammer texting away, but we had to mute him for a little bit here. It was too distracting. So boom. Thank you guys. I appreciate you guys tuning in. You can download us anywhere you get your favorite podcasts, iTunes, iHeartRadio, Spotify, Pandora, anywhere that you like to listen. You can also see us on YouTube if you want to see the world's most beautiful man. So feel free to check us out at Austin Plastic Surgeon on YouTube, and Dr. Nykiel Actually puts a ton of great stuff on his Instagram at SoCal Plastic Surgeon as well. So follow him, and you'll see a lot of body tightening stuff that he does as well. So thanks for joining us for the #1 podcast in the world, as voted by us, and the Dr. Nykiel double hand wave by everybody. Boom, boom, boom. Thank you, guys. See you later.
Bye-bye.